speaker is Dr. ANJALI HOODA. She is the medical director of LiveNutriFit. She is trained in internal medicine, and she has a fellowship in obesity medicine and nutrition support. She's also a certified functional medicine practitioner. She's trained in BHRT, and she's also an author of a health prevention book called Think, Eat, Live Smart. So today we have Dr. HOODA with us to talk more about the lesser known gut testing that should be done if you really want to understand what exactly is going on in the gut. So very warm welcome, Dr. HOODA.
Thank you, Dr. Rouzier. Thank you for introducing me to everyone. Hi, everybody.
I'll share your screen.
Yeah.
Just give me a second.
In the meantime, I can start we're talking about the gut testing today.
Yeah.
So the gut testing, why we're talking about the gut testing, because this is not so common, it's not so known, it's expensive. And why do we do this? And what are the availabilities of this gut testing in our country, So this is, I know this is a patient-centric talk, so I'll keep it as simple as possible. And the reasons why we are doing the gut testing is because some of the answers are not there, even though you have tried to do empirical therapy, some guesswork, and you've tried to treat a patient. But there are some things, the loop is never closing. And there's chronic symptoms and patient keeps experiencing those. And there is also associated, like Dr. Gurang had given such a good talk right now. And even Dr. Nanda, I mean, there are so many treatments and modalities available to treat that. But first, the diagnosis is the important thing. You have to pinpoint the problem. The whole idea of functional medicine is to pinpoint the root cause, right? So if we are not going to the root cause, we are not going to go and actually go and kill that very bug that has been causing these problems. So the tests that are available in India right now are these, and they are available through outsourced distributors from abroad. They are not per se done here, and they cost about something to between $300 to $400 USD. And so one of the tests is SIBO, where you have intestinal bacterial outgrowth, and there's too much bacteria in the gut, and you're having those symptoms, bloating and everything. And like Dr. Nanda talked about the gut and brain connection, which is also very, very common, which we see. Then organic acid testing is actually, this test is done through urine. It's not stool per se. And GI map is, I think, one of the best tests that I think there is for the gut testing. And then there is GI effect. There's a slight difference between the GI map and the GI effect. So I'll go over these, and I'll try to keep it as simple as possible, because if you're going for a testing, it's good to know what you're going into, and you're paying so much, and what are we going to get out of this test. All right. So SIBO, basically, it will show you this. This is a breath test, and it is one of the most simple tests, and it will show if there is too much of bacteria causing all those symptoms, the bloating and the bad gas, and right after food you're not digesting it, and you're constantly feeling that your stomach has increased to another size, and you keep feeling terrible. So SIBO is one of the, usually in gut testing, a lot of the symptoms are overlapping. Leaky gut, SIBO, or something else, whatever's going on, it's always overlapping. So you can never pinpoint, okay, this is what I want to do only. So SIBO is reserved for mainly people with literally the symptoms of the gut. So for other testing, we also take other autoimmune conditions, depression, everything into account. But with SIBO, we are only dealing with the symptomatology, like, what are the symptoms of the patient? It's too much bloating, too much gas, feeling uneasy all the time, and you've been on antibiotics for a while, or you've had some kind of chronic issues, surgeries being done, so those kind of things. So we want to do SIBO testing. It is a breath test, very simple, and this is how it looks like. Can we go to the next slide? All right, so this is a sample report of a SIBO breath test, and it will show us the bacterial overgrowth. So if you see in this, there is there is going to be They'll show you the small intestine hydrogen and methane levels, how much you're producing. And depending on that, the doctor will make the judgment of what to do. And Dr. Nanda has already explained how do we treat that. So I don't need to go into that part. We will just have I just wanted to show how it looks like. And normally you can also ask your physician to share with you the sample reports so you can understand this. Please be an informed patient. Please try and understand what you're going into. Try and see what we are testing for, because there's no point keeping on, because functional medicine is, although it is one of the best ways to treat these chronic diseases, it can become expensive because as doctors, we charge a lot, and as patients, you will be paying a lot even for the testing. So make sure that you understand what you're going for and make sure that those tests are actually going to solve the problem. If the testing is done and it's not going to solve the problem, there is no need for testing. So can we go to the oat test? Now, organic acid testing is for various other things, but it also gives you information about your gut health. So in this, most of the times you will see in organic acid testing, there will be labeled like you're growing fungus or you're growing bacteria in the intestinal tract. This test gives a lot of information, but it gives a lot of neurotransmitter like serotonin, your brain health, your depression, if there is this stuff going on in your brain. So it gives a lot of information regarding that also, but it's for the gut. So if I feel that somebody is having both the issues, like they have gut symptoms plus they have other symptoms like depression or fatigue and constantly feeling overwhelmed and brain fog and stuff, then I go for oat rather than doing a GM map. So in this, as you can see all these neurotransmitters. So they're very, very they're very good informative tests. So you will see that there is a intestinal microbial overgrowth. There's a list of these things, and it's very easy even for the doctors to read this and treat this. And I don't know if there are doctors who are not functional medicine doctors and are looking at this. This is very informative. All these tests are very informative, and at the end of the test there will also be clues to the doctors and the patients of how the treatment plan is going to be. So it is not something very difficult, but this is not done on a very extensive level because people are not aware of this. So the whole idea of this conference for me to be here is to make you aware of what is out there and what can be used for the better testing. I understand, like, you have to go for endoscopy sometimes, you have to go for colonoscopy sometimes, but those will not give you the information, the micro information that you need to treat a patient. So you can see there is a lot of, also gives a lot of information about your metabolic cycles. You can see how this is, Krebs cycle is one of the glucose metabolizing cycles, how you process your food. And you will see that all these tests are going to give us all that information. And this is up to the physician to understand. And on the right side, if you see, there are values, and those are actually the markers of what is up and what is down. And sometimes what is up is what is missing. So it is, so if you don't have to, if you see a high in front of something, it doesn't mean that it's high. It actually could mean that you need more of it. So in this test, it's a little tricky about the high and low. So the patients can't interpret, but the doctors who know about food testing can totally do justice to treatments. And a lot of times, a lot of the supplements can be used in this cycle as well, where you can totally change a person's life when you use this information to use supplements rather than using supplements as a blanket cover. Next slide, please. All right, so you see there is amino acid metabolites, you can see nutritional markers. So this is amazing. If you go to a testing lab and say, okay, I need to see how my vitamin B12 is, I need to see how my B's are, I need to see, this is a brilliant test to use for nutritional markers as well. So if you use this test, you just see how much information we are getting out of this one test, one sample of urine, and it is totally worth reading it and getting out there for patients to treat. So this mind-blowing information, that these things you cannot find in over the blood test. You will not be able to find. So a lot of doctors you will see will be giving a glutathione or a NAC. So this is a test that will tell you how much is missing, what you need to do, and how to proceed further with the patient. Like, biotin, like where do you test biotin? In the lab, it'll take too long to come. And not only that, they're not even precise. So this is one of the best tests for even the nutritional markers. So for if you want information on nutrition markers, on gut pathology, on neurotransmitters, this is one of my favorite tests. Very, very underrated, underdog kind of a test, but very, very good test. All right, next slide. All right, so this is how it shows at the end. There's a lot of information for the doctors as well as the patient for going through. So it's a understanding, because in functional medicine we are working as a team with the doctor and the patient. There is no one side who's correct. You know your body very, very well, better than the doctor. So when you're getting treated for this, you understand what is happening and how you're getting treated. This is the beauty of functional medicine. It's a teamwork. It's like you become family with that patient. Next slide, please. All right, they're explaining neurotransmitters, you want to understand. So when we give you a supplement, like let's say I gave you tryptophan, well, how is it acting? If I'm giving you another supplement, how is it acting on your in your body? And these are the pathways. I mean, you don't have to understand exactly, but because this is complicated even for the other physicians, but you have to understand that something is off. So you understand, if you see that there are some red markers out there, you know that, okay, this needs to be addressed. All right, so this, as I said, again, a lot of information is given in the sample testing as well as your test. Very, very easy to interpret, and very, very easy for the doctors to treat the patient and the patient to understand what's going on. All right. So this, I come to my favorite test, the GM map. This is my favorite testing when it comes to a lot of immune and allergies and digestion. So all the gastric issues do not usually present as gastric issues. You may be having no bloating, no symptoms, no acidity, nothing, but you could be having a lot of bad bacteria in your gut. But that has to be assessed by the physician. What are the things? So 80 to 90% of illnesses are coming from gut, right? And even the stress will change your gut pathology. So you have to understand that this is one of the best tests that's available out there, because it gives you a lot of information about how the gut is doing, what is the lining of the gut, what are the enzymes that you're lacking, what are the digestion processes going on, what are the bad bacteria. If you have autoimmune condition, what are the bacteria that will be important to eradicate from your gut. So this is great. There is definitely some conflict over this test, or with the medicine world, saying, okay, this doesn't represent the gut, but then we are not going and doing a colonoscopy for every patient out there and actually taking out a piece of their tissue. So this is safest, easiest. Give a stool sample and then just get the thing done. I think 3 weeks it takes for this test to come back. Most of the tests take about 3 weeks to come back. But in the meantime, you don't just tell the patient to go away. You start the protocol. Like Dr. Guran said, 5-hour protocol is started right after the sample is given. The only time when you will change your protocol will be basis the kind of bacteria that you will find here. Next slide. All right, so if you see this, these are the pathogens that are highlighted here, right? And now this is one of the sample report where there is like this bad bacteria, C. diff is there. Anything? Anything? Somebody saying anything? Okay. All right. So Helicobacter pylori. Now this is you see that in the stomach washings, when you get an endoscopy, you will find this Helicobacter present or not present. 80-90% of Indians will have this. But is it a pathogen? Now, is it causing symptoms? Is it causing a problem? So if you see in this very test, you can see this H. pylori is actually virulent here. You see, there are so many positives. And this is, in the layman language, this is something that needs to be changed. This is something that needs to be addressed. So when you go through the test, I try to address the things as they come in the order they come, right? So one of the doctors asked me, how do you treat this? You treat it in the way it is seen. So easiest way to treat somebody with the H. pylori is to first eradicate the H. pylori. And that has to be done either through herbal medications, like Dr. Nanda was saying, or you can eradicate it through proper allopathic drugs. which they're available. And it is up to the doctor to see how long the therapy needs to be given depending on the symptoms of the patient. And then if you can see, then you also see normal bacteria present out there. Now if somebody has a good gut health, they will have a good quality mix of all the bacteria, right? And if you have things that are on the low side, like if you see something low on this, that this patient will need a very, very good high dose of broad spectrum probiotics. Next slide. All right, so now you see opportunistic bacteria. Now this is what I mean by this test being so important and so good. You can see all these high values, right? Now the doctor has to know that how do I treat this. Now one of the bacteria that you can see out here is Klebsiella. Now this is important. Why? Because it could be related to, if you're suffering from rheumatoid arthritis, you could be suffering from any kind of autoimmune condition. So Klebsiella is one of the worst ones when it comes to ankylosing spondylitis or rheumatoid arthritis, as I said. And this can be eradicated right here. So if you've been suffering from something, you can stop your disease process like the moment you get treated. So you don't have to live with a condition, which obviously in the regular medicine world, we are not able to find the issue and stop it. People have to be on meds for all their life, but here you can actually eradicate the bacteria. Next one. Yeah, so on the previous slide, I did forgot to mention that there was no fungus growth, right? So you can see there is a fungus column out here. A lot of patients will have a lot of fungal growths. And that is, again, a treatment thing that you can treat it with herbal medications, you can treat it with allopathic medications, but that needs to be treated. But here this is negative, but in the real world, I see a lot of candida being high, and you can see that in your own patients, or in your whoever's watching. Like you can have a vaginal discharge, you might have ringworms, you might have fungal nail infection. So you understand that's actually started in the gut and overflown to your other body parts. You can have a lot of dandruff. So those are the things. That is the time when I would definitely look at this part of the test, and put the patient on the right protocol. So 5-hour protocol is like a blanket protocol, but then when you go into specialized treatment, this is you attack the fungus, and you put the patient on a certain kind of a food plan, because of course fungus loves the sugar, and you understand what I mean by that, right? Next slide. All right, so you sometimes can also see parasites and worms, which in a regular stool test you may not find this. If you got a regular stool test done for stool over and parasite, which is a very common test done by the labs all over our country, you will not find this this level of information. You will never find that. You might find tapeworm, you might find some regular stuff, but this is not available. So this, you understand how this has been so explained so well, so many things. And a lot of us suffer from parasites. It's very common foodborne disease. And if you find something, of course we have to treat it. And some of the times, there could be a couple of things that you can treat with a single antibiotic or a single supplement. So you don't have to go on like 10 supplements to treat a condition. Food first approach is always the best approach. Food first approach is always the best approach. But if you have protozoa, if you have parasites, we have to give you allopathic medication from my perspective, but also sometimes herbals work. But it's very difficult to find a good herbal substitute for sometimes the allopathic medication. Now, if you see digestive health, what we were talking about in Dr. Goran's talk, now this is elastase, which can be very low in certain people. And if you also see that beta glucuronide is very, very high in this person. So you understand that this gut health is very compromised here. Sometimes you will also see secretory IgA being abnormal. So this is normal out here, but if you see in the real world, the gut lining, IgA is your police, right? So if the gut lining sometimes is so bad that you have to rebuild that gut lining with a proper approach. And then also you will see anti-gliadin in IgA, which means, are you allergic to gluten? Is there a problem with gluten? Is gluten harming you? And a lot of times, if you do a celiac panel, you will never get the answers But here, if you see, you will get the gluten sensitivity part also. So gluten sensitivity is something which is only when you stop gluten and you realize that happens. Then calprotectin is done with colonoscopy as well, but this is another additional information that you can get on this stool test. Calprotectin is telling you about the inflammatory part of your gut, right? So if calprotectin is high, you definitely could be suffering from inflammatory bowel disease, not simple irritable bowel disease, but this can be this is a very, very important information. I think one of the most important information on this test is going to be the calprotectin, which substitutes for a colonoscopy. So you can understand why this is my favorite test and why we are getting so much information out here, and we can do great wonders, and people can become completely better, and they can get rid of a lot of autoimmune conditions as well. Next slide. All right, so these are the the resistance they will tell you. So if you are treating somebody for H. pylori, and these are the medications for treating H. pylori, and then you will find that there is resistance because people in India have a tendency to eat too many antibiotics over the counter, and it's just not controlled a lot. So I feel that resistance is very, very high. So if you know and you see the resistance, you know what to give this person apart from this. So this is basically that information. Next slide. All right. So we come to GI effects. All right. So yeah, that was about the GI map. And now GI effects is a similar test to GI map. It's again a little more on symptoms-based test again. Like GI map, you could be using for other things, and GI effects you will be using for other things as well, as somebody with all these symptoms of gas, bloating, indigestion, diarrhea, and all that stuff that you face. I think 80% of population is facing these kind of things because our food isn't right, our timings aren't right, and we get a lot of stress. So this kind of thing, and some people have exaggerated symptoms of these, and that's how when we look at GI effects, and it's a very, very good test again. But if you compare the two, GI map would be my go-to test. And let's see what this shows now. Look at that. Now, so self-informative. I mean, look at that. So self-informative. It tells you about your maldigestion, it tells you about your inflammations, it tells you about your dysbiosis. So if you do not have a SIBO test available, you can have this test, because it will again tell you a lot of information overlapping. Like if you did an OAT test separately or did a SIBO separately, but then GI effects and GI map are similar testing, but again, this can be done for the dysbiosis as well. So it gives you a absolutely clear picture of how much dysbiosis you're having, if you're having parasites, if you're having a metabolic dysfunction. So this is again a great test, and actually depends on the clinician who's treating you to make that decision. Okay, this is a test I want to do if this patient is going through this. So if you have a patient with SIBO, you have a patient with depression, and you have a patient with a lot of gut symptoms, this is a test you need to do. This is the test. GI effects will be the one. So to remember its effects, so effects, how it affects your body. So the GI effect is another very, very good test. So it'll tell you all about the dysbiosis. So when we saw the SIBO test was showing us all this methane and hydrogen, this again will show that. This again will tell us that information, and then also give you the inflammation score of the gut. So then you can also see commensal abundance, like how much good bacteria everybody should have a good and bad mix, right? So it will tell us how much abundance you have in your belly. The more the microbes, the more the different types of microbes, the better the gut health is. So you have to have a variety. You have to have a variety of different bacteria. So antibiotics actually will kill the good and the bad. So this you have to be careful. Next slide. All right. So this tells you about your, the microbial health, which I was talking about. The more you have, the better it is. And and if you have less of these, then you know that you have to, create that with food and with maybe probiotics. All right, so again, so we talked about elastase in the last test, like the GI effects. And again, in this test, we are also getting calprotectin. Imagine if we are getting the IG, we're getting the calprotectin, which is the inflammatory marker. But in this test, you will get metabolic answers too. So if you see short chain fatty acids are not present in this person, this tells us that the gut microbe microbial health is very poor. So what happens, what is short chain fatty acid is like when you eat your food, the bacteria will come and convert all the food into short chain fatty acids, which are very essential for health. And sometimes they will be very, very low. And short chain fatty acids, for a good example is supplementing with ghee, but also a lot of fiber. And then depends on so somebody who has a lot of dysbiosis and you end up giving a lot of fiber, they can be a problem, right? They don't have enough enough stomach acid to digest that thing. And then if you have somebody with low pancreatic elastase, like in this test, you have to give enzymes, right? So you have to give. So this is where the clinician will make a decision. Okay, this patient has less short chain fatty acid. This patient has low elastase, and this patient has a calprotectin, high, which means that I need to make this person first lower inflammation. Again, going back to 5-hour protocol, but again, it's going to be subjective. 5-hour protocol, very, very subjective. How you want to remove, how you want to replace, what all you want to reinoculate in this person. So very easy thing that I'm telling all the clinicians and everybody out there, that if you supplemented ghee in a person like this is an automatic short chain fatty acid. So it's butyrate, right? Ghee is butyrate. So yeah, that is something that is the treatment part. I promise I'll not go into this, but this is such a great information on your stool. Next slide. All right, this is again commensal bacteria. A lot of information similar to GI-map. You can get all that. Next one. All right, this will tell you all the, so it will give you the pathogen and non-pathogen. So mycology culture, you can see that we had talked about Candida in the last test, GI-map. You can see mycology culture out there, and you will see that are you growing the yeast in a PP? You understand? It is a pathogen, right? All right, so this is again more information on the parasites. You can get a lot of parasites on this, and then if you get a lot of hominis and a lot of E. coli, you know that you have to treat this patient. Again, this is more about parasites. You understand this, and all right, and yeah, antifungal natural agents, what you can use, and also tells you resistance. And again, a lot of resistance can happen to Klebsiella, and that's probably it. I don't know. I hope I explain these tests better, but because this is something so rare out there, clinicians and people watching, make sure you give these tests a fair chance and treat with pointing out the problems.
Absolutely. It was very informative, Dr. Hooda. Thank you so much for sharing it. And also, the kind of information that we can get from all these functional tests. Thank you so much. There is a question. I'll just question. Okay, so that's not related to this. That's okay.
Okay, great. Yeah. Thank you
all
for
right.
having me.
Thank you.
I hope you have rest of the good day, and take care, everybody. Have a great Sunday.
Thank you. Thank you.